President Obama, Speaker Pelosi, and Senator Reid simply don't get it. The vast majority of Americans and the vast majority of Arkansans have rejected this proposal, yet the Democratic leadership continues to pursue passage through a variety of parliamentary and procedural acts and tactics that include reconciliation on the Senate side and the potential, what's called the slaughter bill on the House side, that will deem the bill to have been passed even without an additional vote. Governor Beebe is quoted simply as saying, expressing his concern about the potential of a $205 million Medicaid budget shortfall that would result from this bill. Other governors, like Governor Bob McDonnell of Virginia, are taking aggressive steps to voice their opposition to this health care reform debacle, rather than remaining silent and on the sidelines. In fact, with Governor McDonnell's leadership, the Virginia legislature just passed a bill that would refuse to pay the additional unfunded mandates on the state, relying on the 10th Amendment of the Constitution. During this entire debate, Governor Beebe has remained virtually silent. If I were currently the governor, I'll tell you what I would do. I would apply as much pressure as possible, both privately and publicly, to persuade our senators and representatives to vote against this legislation for the good of Arkansas and our citizens. The problems we're facing are simply too important to remain on the sidelines. So today, it's very simple. I call on Governor Beebe to take a clear, decisive, and unequivocal stance either for or against this bill. There is no more time to merely express concern. It's time to act. Thank you all.
Same thing that Donald did in Virginia, and that is to analyze exactly what the repercussions are for our state, and then pass a bill that would, in effect, say we're not going to participate in this. We're going to fight this at every step, and if that means taking it to the Supreme Court, that's what we're going to do.
Just to follow up, you think the number of uninsured will go up under this health care proposal?
Absolutely, because what's going to happen is that when a businessman is faced with the prospect of going out of business, they're going to make those tough choices, and sometimes they're going to be long-time employees that they would like to keep on, but in order to survive, in my opinion, they will be forced to make that tough choice and lay people off, which means that now they're not going to have a job, which means the 8% unemployment rate is going to go up, and they're not going to have insurance either one. We simply can't do that to Arkansans. And especially in view of where our national deficit is right now, and the implications of yet another $1 billion or $1 trillion over the course of the next decade by some of the most conservative estimates, we simply can't afford to do this, and it's time to step up and take a position. When you look at this, think of this. This is 500 pages. We have 2,733 pages in this bill. I can assure you what will end up happening ultimately is that the amount of regulation that will be involved in this will literally be probably tens of thousands of additional regulations and confusing, overburdening regulation that we simply don't need in this country right now. We need to be reducing the amount of red tape, not increasing it.